Hi everybody, my name is Dr. Rabin, and this is from Providence Health and Services Health Beats. And I'm here today with Shar Jackson, and we're going to talk today about some exciting topics, screening and healthcare and prevention. And I am a gynecologist. I practice gynecology only in Burbank, California. And this is Shar Jackson. And why don't you tell everybody a little bit about yourself?
Well, I'm an actress and mother of four. I'm a daughter who's very concerned with her mother and her health, and because I've seen my mom kind of go through some crazy times, I want to make sure that myself, my sisters, my friends, and my kids are all taken care of before there's a problem to take care of, if that makes sense.
Sure. And so today we're going to talk about something that most people don't think about, going to the doctor when they're not sick.
Right.
It's almost counterintuitive. They want to wait till they're sick and then they go in.
9 times out of 10, they don't even want to go when they are sick.
Well, there you go.
You know?
I think there's a gender difference in that too. I think men are less likely.
We have to drag you guys to the doctor.
It's a macho thing.
It's insane.
And that brings us to the topic of, what is a health screening?
Right.
I mean, what does that mean? It can be as simple as what we call biometrics, just seeing how much somebody weighs compared to how tall they are. I always say that my weight is fine. I'm just a few inches short of my ideal body height.
See, I say something similar to that. I'm always like, no, everything's fine. I'm just having a short day.
Or vertically challenged.
Vertically challenged, that's my favorite.
But something as simple as knowing your weight and knowing your body mass index and where you fit on that gives you the idea of whether you're in the normal weight, overweight, or into obesity, and there's actually super obesity or morbid obesity. And the importance of that is sometimes we're fooling ourselves and we don't realize, I'm just a little heavy or I'm just a little chubby, and that if you realize that you're really into obesity for real, that you might take it a little more seriously and do the intervention, the lifestyle changes to follow a better diet or lose weight.
Right. We love to be in denial, and I think that's why people don't do a lot of preventative screening, is because they don't want to hear it. Once you hear that there's a problem, I don't know, you feel like, they're all just scared to hear it. But I feel like you have to know in order to fix it. You can sit back and imagine, everything's great, even though your heart rate is ridiculous and your blood pressure is ridiculous. But no, I feel fine. I can stand up and walk around, and that's not living, And if you're not taking care of yourself and you don't know these things, then it's going to lead to bigger and worse problems.
So when we do go in and we have our health screenings, we sometimes get really important advice, like if somebody's at high risk for stroke or high risk for a heart attack, and we modify our health habits and some of our lifestyle things. Now, in your family, you've had some screening wins and maybe a screening fail.
This is the thing. So sometimes we get so caught up in our lives that we forget that we need to go and get these screenings, And in the case of my mom, she forgot. I don't know if she necessarily forgot. She just put it off, Like other things were more important. She was working a couple jobs. She had a big family to take care of. So it wasn't on the forefront of her mind to go and make sure she got some screening done. And then I remember one day she was feeling normal and had got up to get ready for work, and all of a sudden she felt like she was having a heart attack. So we wake up and we're all freaked out. We call the paramedics, and we find out that once we get her to the hospital and everything, that she had an aortic tear.
Wow.
And now I don't know what the screening process for something like that is, but I'm sure that there's something to let you know that, your veins or your arteries aren't, the walls of your arteries aren't as strong as they used to be or whatever. But she had to have an aortic dissection, and actually she's had 3 of them. And so it's a miracle that she's here. But going through that process with her and seeing how it just came out of nowhere and almost took her away from us scared the hell out of me. So I make sure I go get screened for everything. I had to fight my doctors to give me a mammogram because I wasn't 40 yet.
Okay.
They wanted to argue. I was like, look, I don't care what what you say. I need to go ahead and check this out. And so I'm really on top of those type of things, but it's all because of what my mom wasn't on top of, if that makes sense.
So your mom, perhaps if there were some underlying conditions, high blood pressure, maybe there were EKG changes that might have prevented that if she had been going, but life got in the way. She didn't put herself first. This is really typical in my world, where women.
Because you
in
deal with
general.
women, absolutely.
Women take care of everybody else first. There's a book that they make all the business students read. You might have seen it, 7 Habits of Highly Effective People.
Yes.
7 Habits of Highly Effective People. Habit number 7 is called Sharpen the Saw.
Yeah.
And the idea is the lumberjack is out there in the forest, and he's sawing down trees and sawing down trees. Little guy comes up to him and says, "Dude, why don't you stop and sharpen your saw?" He says, "I'm too busy."
Yeah.
So if Mama would stop and take care of herself, she'd be able to take care of everybody else better.
Absolutely.
You have a success story
Absolutely.
in terms of screening. Tell us about
And
that.
that happens to be from a male family member.
Go figure.
But no, my uncle was diagnosed with pancreatic cancer.
That's a bad one.
Yeah, and because of his screenings, he caught it in time. They operated, and he's still with us now, cancer-free. So, I definitely believe that you need to screen, you need to take care of yourself, you need to look in even when you feel amazing, because it is a matter of life and death.
There's a long, long list of all of the screening tests that are possible, and you were talking about mammogram, and it's interesting that there's age-related criteria for when you get certain things
Right.
done. There's also risk factor-related criteria for when you get things done. Not everybody needs everything done,
Right.
and not everybody needs to wait until they're 40
Right.
or 50 for this or that. So many of these screening tests come down to having a good relationship with your primary care physician, your doctor, your healthcare provider.
It's going in for your regular visits and things, right?
It's going in for the visits and having the conversation. And for ovarian cancer, you're hearing things like really vague things, like I'm having abdominal fullness, or my bowel habits are changing, or I get very gassy, things like that are so vague. But to the good listener, you start to hear these things, you say, you know what, let's do an exam, let's do an ultrasound, maybe we'll do CA-125. If you actually pick up on that you are hitting some of those buzzwords and those key points, then it does make sense to do that.
Right.
When it comes to screening for cervical cancer, it's a little less controversial. We have the pap smear. And the pap smear screens for how do the cells of the cervix look and whether or not a woman has the HPV virus.
Right.
And what's interesting in that whole world is the Gardasil vaccine that the young girls and
Right.
now the young boys are getting. We may see in the future a generation that's not having cervical cancer. The screening rules and guidelines change. About every 5 years they change their mind about what year that we get started, how many years apart each of the screenings go. It used to be you turn 18 years old, you're doing a pap smear every year,
Right.
period,
Right.
end of statement. Now that we have the HPV testing, if you have normal cells and negative for the HPV, we can wait 3 years between pap smears.
Oh, wow.
The problem with that is that patients hear that and they think that they're going to go see their doctor every 3
In
years.
3 years.
The pap smear is just that swab.
Right.
Every year we do a breast and a pelvic exam. We have the conversation with our patients. We check their weight, we check their blood pressure, we talk about their lifestyle habits. Are you a smoker? Do you wear your seatbelt? Do you practice gun safety in the
Right,
house?
right.
There's all sorts of things that happen during that pretty benign seeming visit that we can really intervene and say, hey, you really need to start looking at your weight. We need to follow up on your blood pressure.
So as a physician, what do you recommend as far as screening? How often do you think that someone should go see their doctor?
I think that most men and women should see their primary care physician. In some cases, the gynecologist is your primary care physician at least once a year. Once a year if nothing's wrong. And you have your general health screening, you do the intake paperwork, you go through your risk factors, you do your blood pressure, your weight, and some of the basics. And then from there, based on your age and what the doctor takes from you, they can order additional screening tests and sort of do that check-off at your 10,000 mile checkup and your 50,000 mile checkup. And this is when nothing's wrong.
Right.
I think people are reluctant to even go in when things are wrong, but at a minimum, once a year basics.
So what if you're someone who is super reluctant to go to the doctor? You're just resistant. That is just not what you want to do, but you do want to kind of find out if maybe you need to. Is there anything that could kind of guide you in that direction?
There's actually some online risk assessment tools. Providence has a system of questionnaire-based risk assessment tools for specific conditions like stroke, obesity, joint health, heart health. And you go in there and you answer the questions, and it actually gives you whether or not you're at risk for these things. And maybe that would be the motivation
Right.
to take that to the doctor and say, maybe I really need to be checked for some of these things.
So I have a primary doctor, but a lot of people don't. And what are some of the critical things that they need to know why it's important to have, a regular physician, like in their 20s, 30s, 40s? Like,
well, I think we all have a primary care physician when we start with the pediatrician. We're born, you go in, they do all the height and the weight and the measurements, and they do lots of screening, because especially in that age group, to find out that you have a particular condition, a hole in your heart, some type of an allergy or some metabolic problem, that could be life-changing.
Right.
And then, unfortunately, you outgrow the pediatrician, and now you're kind of floating free. You're 18, 19, 20, maybe you're off in college, maybe you'll go to the clinic if you have an issue or a problem. I think it's really important, and I tell my patients to bring their daughters in at that age, even if we're not doing an exam, just to have the introduction to the idea of coming in and having somebody that you can have that conversation with, talk about the things that you're concerned about. And then starting in the 20s, there's definitely checking your blood pressure and getting some of the basic things, lifestyle habits, if somebody's a smoker, really driving home the points of why that's a great habit to get rid of.
Right.
If you're overweight, if you're having trouble sleeping well, and these are things that in your 20s are really going to lead to some lifelong health changes if you can nip those in the bud. Doing some screenings, again, as you're aging up through the 30s and the 40s, you start to get into things like the regular pap smears, mammography. For the men, they're going to start to do testicular self-exams and getting guidance in that, because you can't really learn that one online. Maybe you can.
A lot of stuff online, but I don't know if that one's there.
And then in each age group, there's a certain set of questions that we ask the patients, and then there's a certain set of screening tools and screening tests that we would recommend. And having a primary care physician that you are getting to know through the years and they're getting to know you is really important, because like you said, when people are shy or there's a trust issue, and being the critical listener and knowing your patient, say, now you're holding back on me. Tell me how many drinks you really are having a week. Shar.
Hey, you ain't got to worry about me. But no, I think that that's a really important thing, is to have that relationship. I went to a gynecologist who wasn't my normal, and I didn't walk away from that experience feeling great.
Just didn't connect? Didn't have a good vibe?
Didn't connect. And I think you need to, when you're focusing on your life and your body, you need to be able to trust the person that you're working with. Okay, so we've already established that everybody should come in at least once a year, but they need like a little checklist of knowing what they should come in asking, like what should they ask, what, like, any questions, anything that they've been feeling about their body or whatever. What do they need to bring to your attention as a physician when they come in for that yearly?
Because it seems like our visits are just getting shorter and shorter, I think it's really important for patients to prepare for their visit, to get the most out of it they possibly can. And I ask my patients, and my nurses ask the patients, to be prepared with your top 3 questions in order of importance. That way, if you hit the first one and it was the most important, that's all you get to, at least you feel like something good happened. But if you can pop through those 3 and maybe you can have a longer list, I think that's important. I think also bringing with you to the visit any other recent tests that you've had done. It drives me nuts when patients come in, even for a second opinion, and don't bring all of the materials. I had this report that said, I go, do you have that with you? So I think that having your own sort of personal health record, whether it's a folder or something virtual, just to be collecting some of your information over time so that you can build your own little portfolio of all the important tests that have happened, even if it's just logging it in. I love it when patients have their medications listed, their allergies listed, their supplements listed. And
we do that with my mom. It's crazy.
It's all good, but the doctor needs to know what all you're doing, so that they're not going to provide you with some new prescription that'll have an interaction.
What are the most important things that you think that people should at least be screened for?
I think it's really important that people be screened for their lifestyle risk factors. And we're talking about their smoking and drinking habits. Even their sleep habits has been shown now to be a really big factor for your health.
Mine are garbage. We should talk about that later. I mean, I know you are a gyno, but we should talk about my sleeping. It sucks, but go ahead.
Sleeping is so important, and it actually ties into heart disease and obesity, and of course just being fatigued all day long. That blows.
That explains a lot.
So it's important to go in, and based on your risk factors, based on your age, and based on your personal health history, you got to start checking off those things and getting the tests that are relevant for you. It's not all just a cookie cutter approach.
And you should pay attention to your family history, right?
Family history is important as well. That can definitely give you some clues as for what you might be up against in the future. It's interesting how genetics and genetic testing is now becoming a big thing.
Right.
And if you have people in the family with breast, ovary, and colon cancer, there's some genetic markers that if they are tested positive for it, and you're tested positive for it, it really elevates your level of risk and what kind of interventions you might consider doing. Sometimes when screenings actually pick up an early disease or an early tumor or some kind of changes that are precancerous, it entirely changes the whole trajectory of that person's cancer or that person's eventual disease process or what kind of treatment they need to get. You catch something early, you may not need radiation and chemo and all those miserable things.
Right.
And it's in the example of a mammogram, by the time you can feel something, that's probably a year or two later than a mammogram might pick something
Right.
up. And that makes all the difference in the world.
I believe that.
Colonoscopy, for instance, is one of the rare screening tests that actually are fixing the problem. When they go in there and they're looking inside of your colon and they see a polyp, they remove the polyp right then and there, and those are the bad boys that can become cancer one day. And that's one of the only screening tests we do that actually during the screening test, they're fixing the problem.
Right. That's awesome. I want to thank you so much for everything that you've taught me today and taught everybody listening. I am a stickler now because of my experiences with my mom and my uncle, both on the positive and negative side of it. And I 110% am in my family's butt making sure that they are all getting screened for everything possible. And now, because you've kind of broken it down to me, I know I don't have to rush for everything, but there are certain things that I definitely want to stay on top of. And I really hope everybody else decides to, listen and do the same thing, because we only get one family, we only get one body, and we got to love and take care of it.
Well, I want to thank you, Shar, for bringing some of your personal experiences and your family history and your passion for screening to the Providence Nation.
Well, thank you for having me, and thank you for your time, because I needed all of this conversation. Kind of awesome.
This was a lot of fun.
Well, it's fun.
Thank you.
Anytime, love.